We are excited today to bring Dr. Danielle Barber from our Medical Advisory Board and from Children's Hospital of Philadelphia. She is a pediatric neurologist, a clinician scientist, so she actually does research with HIE, and you're also a mom to a child with HIE as well. So you're the triple word score, as I like to say, or trifecta. In this community for sure. So welcome. And for those of you that are watching, make sure that you let us know where you're joining from. We're going to be talking through today's topic, which is,
navigating the therapy.
Yes. Yeah, so hold on, sorry. Facebook just like gave me a notification that I wasn't live anymore, but let me just double check. Sometimes this happens. Let me see.
I have a little flag in my upper left corner that does say
okay.
Facebook.
Okay, great.
Is that working?
Yes. Yep. Okay. It's confirmed. I have my backup on my phone. Great. So yes, make sure that if you're joining us, you're letting us know where you're joining from in the comments. And then as we go along, any questions that come up, please feel free to drop in the chat. We will try to get those answered and integrated. And just a reminder, we can't, Dr. Barber cannot give any, situational medical advice, but certainly can talk through different topics and questions on a broad scale as opposed to an individual consultation basis. So yes, our topic today is navigating the therapy maze, which is very timely because this is something obviously our families look at the beginning of their journey and throughout of what is the best way to help their kids reach their individual potential. And so I'm just really excited that you're here and that we can have this conversation today. So why don't you share a little bit more about, you and how you got interested in, from the neurology and research side and HIE as well.
Perfect. So thank you for inviting me. I'm so happy to be part of this community and so, so happy that Hope for HIE exists, because it didn't exist when my daughter was born. And it was something that was really lacking for me personally as I was traversing that journey almost 11 years ago now. And I think that so much of what I've learned along the way, the most useful pieces came from other parents who were just a few steps ahead of me. And so I think that the work that you are doing through Hope for HIE is spectacular and really useful. And especially the peer mentoring piece is really, really useful. So I encourage everyone to take advantage of these wonderful resources that exist now. I guess a little bit about my background. I have always been interested in neuroscience. I was a neuroscience major in college, and then in medical school knew I wanted to do something related to the brain, and then did a PhD in neuroscience. And then when also always knew that I loved children, so found child neurology and knew that I was headed in that direction. And then as I was getting ready to start child neurology training, my oldest daughter was born, and she came early at 33 weeks gestation and with HIE, and so had a whole new experience of being in the NICU and what that was like. Had two more healthy children during residency, during pediatrics training, and then one during neurology. And like you said, I've been now I'm a child neurologist. My clinical focus is on kids with HIE or babies that have had any kind of early life brain injury. And my science focuses similarly in the lab in a mouse model for HIE.
So just to clarify, because this was a new thing for me to learn as well, Can you talk a little bit about what it means to do research with mouse modeling?
So, you know, many of the advances that we have in science, in medicine, come originally from more basic science models. And we learn so much from these models. So currently our only real treatment for HIE in the acute time period is therapeutic hypothermia, right? Cooling. And that originally came from work in a mouse model. So there are many scientists around the world who are doing these experiments in an ongoing way and learning lots more on what treatments could potentially help babies who've had this kind of brain injury.
Absolutely. Yeah. And, we talked to Dr. Brian Kalish, who's also on our medical advisory board last week, and he does some mouse modeling and research up in sick kids. And, it was really, I think, interesting to help everyone understand a little bit about the process and how sometimes, I'm sure you found in your research too, things that might look like they're working in the animal models don't translate to humans. And that's where the frustration comes from, and where, but again, the process of research is just continually trying to find what can work. Yeah. So when we talk about, therapies, and obviously, I think it's pretty well accepted that early intervention therapies are, they're evidence-based. There's tons of decades of research on it. And we consider those in the realm of physical, occupational, speech therapy, kind of the frontline therapies out there. But then, we have this like secondary halo of things that exist out there that have either evidence or not behind them, that our families are just constantly bombarded with. And so it becomes kind of a quagmire of different options to consider. And so I'd love to hear from your perspective how you personally walk through that in your own head, and then kind of how you help families navigate through that as a clinician as well.
Yeah, that's a great question. And there's so many parts to that. And I do want to talk a lot more also about the role of therapy and what therapy looks like, especially for infants and when the children are really young. But specifically to I think the heart of your question is about how do you decide? There's so many you have a menu in front of you of so many different options. How do you decide what is best worth your time and what is most going to be helpful to your child? And that's really hard. But I have a couple guidelines that I think are really helpful. And this is how I've made decisions for our own family and what I advise my patients as well. So the first thing is to make sure you do no harm, right? You don't want to try a therapy that has risk to it. There's no reason to do something that could potentially hurt your child. Okay, so if you're that should always be the first question. What's the downside of doing this? Is there any way that this could hurt my child? And if you're not sure, you should always ask your doctor. That's a good person to ask to find out what they think about a particular therapy or a particular treatment. Another good place to look as a resource is the paper from Iona Novak's group, which I think, Betsy, you have linked from the website and can share in the chat, hopefully.
Yeah, sharing it right now, actually.
Perfect. It's just such a well done overview that goes through so many different options and can be useful as like a map to tell you about things that you might not have heard of before, or also to consider what might be most effective and really has good evidence behind it. What we don't have enough evidence because it's hard to do good studies on everything, and what does have sufficient evidence to show that it's not helpful. and potentially even harmful. And then there are a lot of things out there in the world that we just don't have enough information about. And then it becomes parent decision to decide, is this something that's worthwhile to try? And the way I navigate that situation is really thinking about your resources. Your resources, your resources include your time, your child's time, your energy, and money as well, right? And you have to think about, when you're thinking about taking on a new therapy, think about all of those things. Which of those resources are going to be, how much of those resources do you have to invest in this new therapy? Maybe it's not a lot of time, but it's a lot of money. Or maybe it's not a lot of money, but it's an enormous amount of time. And all of these resources are finite. So by definition, if you pick one of them, you're taking away the opportunity of spending your finite resources on one of the other options, right? And so if you're, there are some therapies that are proven effective, right? We know that, as you mentioned, the early intervention therapies can be really helpful. So I recommend investing your time, your energy in those directions that are known to be most helpful. Hopefully that makes sense.
Yeah, definitely. Yeah. And, I think one of the things that, and, I had a conversation a couple of months ago at the Newborn Brain Society conference when we were, connecting and also connecting with Dr. Novak, who is, was kind of the lead of all these papers that we just shared in the comments, is, how do we have these conversations? And she said, what a lot of it boils down to is, unfortunately, there just are not a lot of effective treatments out there. Like there is limited, which is changing. I mean, there's, we talked to, like I said, Dr. Kalish last week about, the things that he's trying to take from other pieces out there and trying with HIE. There's all sorts of things that are on the horizon, and then there's things that we know because of how the brain works that are not effective and have been proven to not be effective. And as much as we keep trying to reprove that they might be effective, that we just don't get that. So it is a complicated journey, because so many of our families, as like, will literally go to the ends of the earth for their children, will go bankrupt doing so, will max out time and money and everything to have an ounce of improvement in their kids, and it's really, that is one of the, I think, most heartbreaking parts of this journey, is to see that happen sometimes.
Yeah, it is really hard. And this is certainly where there's an important role for more science, right? Mm-hmm. And you're absolutely right that, when I think perhaps where some families, especially in the early days, there's so much uncertainty and nobody can tell you for sure what the prognosis of your child is going to be. And it's very easy to go in as a parent. It's very easy to spiral with a lot of negative thoughts and to look for any kind of savior. And we don't have miracle solutions. We don't have cures right now. And often the most effective treatments are the ones that are a lot of hard work. Right, just hard work through PT, OT, speech, we have a lot of work to do as a community, certainly, in developing more effective treatments.
Mm-hmm. Yeah, definitely. But there is a lot of promise. So there's a lot of things that are going on. In regenerative medicine that could potentially help. And, a lot of these things are getting rigorous studies and unlocking and, all of that. So, and I think what's really important is that people know that there are people working on these these things that not just at birth, which, you know, obviously is like a critical time or at the time of injury. And we've talked about, you know, for for HI events that happen outside of the neonatal period. But there are people that are working on things that are also, you know, kind of out of that either cooling window or, you know, whatever as well.
Yeah.
Yeah.
I would love to add a few things about therapy in general, especially for the baby times, as the early days.
Yes.
So a couple things. One is that the goal of early intervention therapies, especially for a newborn, it's really hard to make the stars align and get the perfect time when the baby's not sleeping or eating, or, you know, is in that perfect small window of time where they're really awake, alert, engaged, and receptive to learning new things. And you cannot time the PT visit to be exactly at that window. And that's okay in those early months. Really, the goal of the therapy in those early times is for those therapists to be teaching you, to be teaching the parents how to set up the child's environment in a way that the child can maximize their learning when those awake moments happen. So really, they're teaching you to be the child's therapist. It's much more about building that relationship than it is about, you know, the minutes that the therapist is spending with the child directly. So, and then, you know, I think especially parents with new diagnosis don't always know exactly what therapy looks like, right? Maybe you imagine like going to a gym and working out or something, but that's really not what it is. You really want to be able to incorporate that therapy into your life. So OT can look like sitting on the beach and playing with your child in the sand, building a sand castle, right? Yes. PT can look like playing tag with the siblings in the yard, right? You really incorporate it into your life, and you know what your child's challenges are, and you know how to push your child forward, and you incorporate that into their everyday life. And so it's not about the hours that the child is with the therapist. It's about how they go about their everyday life. That is therapy. That's how they get better. That's how the environment and the context that they're in helps them learn and grow and keep progressing forward. So, so I think that's an important piece. And then going back to the, again, infant, really early days, we know that before you can get motor development, you have to have sensory development. So something that, especially in the really very first days when you just bring your baby home from the NICU and your, you know, early intervention is set up to come, but they haven't come yet, and you don't know, like, what can I do? Yeah. I think that massage is a really important way that you can connect with your baby and promote their sensory development. So before we get motor development, we have to have sensory development. Can you imagine, like, using your hand, right? You can't move an individual finger if you think that you don't know that it's an individual finger, right? So you need to learn that, you know, from sensory input, that this is one finger. It's not one block that moves all together, right? And so developing that sensory information is really important for driving the later motor development. So those kinds of things are things that parents can do right from the very beginning. You know, massaging your baby, touching your baby, giving different kinds of sensory experiences, And then lots and lots of reading and talking. You can't start reading too early. You know, the auditory cortex development is really important, and the sound of talking is very different, or conversation is very different than the sound of reading. And you know, when you're reading, it's much more fluid than talking in a conversation, and that sounds different and is important for babies to hear, to promote their development of their language skills. So so start reading early. I can tell you that when my oldest was an infant, my husband was reading a biography of Steve Jobs at the time, and he was sure that her favorite character was the Woz, Steve Wozniak, right? Like, I mean, she clearly, you don't have to read baby books. You can read whatever you're reading to yourself. You know, I was studying for my medical boards, and I, for hours, had her on my arm, you know, repeating the metabolic diseases that I needed to memorize. And it doesn't matter what you're saying, as long as you just keep on talking. And then also, when you're just, even when you're not reading, just keep on talking. Narrate what you're doing. Just let your stream of consciousness thoughts be out loud, so that your baby can hear them too, whether it's the shopping list from the supermarket, or you know, that you're changing their diaper in the moment. Just keep on talking.
Yeah,
those are useful things.
Definitely. You know, and we were recently at the neonatal therapist conference with NANT, and you know, it's so interesting to hear from these neonatal therapists who, you know, especially in our talk about HIE, so much of their feedback was, yeah, we want to get in with those kids as early as possible. You know, it's so interesting to get that perspective, because they are the ones that kind of help build that sensory system as well, you know, in that environment that is an unnatural environment, you know, many times for babies. And just thinking through how, you know, that perspective plays in so much to, you know, I remember in our own experience being told to go home and like give Max all these worldly experiences, put his feet in the grass, put his hands in the sand, you know, like all these things. And, you know, thinking back now, it's like, oh yeah, that was all sensory input that they were, you know, telling me to do to help him. So, you know, which again is like, you have those therapies early on to teach you how to do that with your environment. And then, you know, as things progress, as kids are able to tolerate more, you know, we hear a lot of families that say, my kid, you know, my baby's not able to tolerate therapy. They're miserable, like up until like the first 2 years or even further. But, you know, I just connected with a family this weekend that had said their daughter's now 2, and she's doing some more intensive, you know, physical therapy stuff right now, and she's enjoying it and tolerating it. And she's like, oh, I wish someone had told me that, you know, like, it's not this race to, you know, to the end of any, you know, arbitrary deadline, that like this can and will get better as, you know, as things go through childhood as well. And that, you know, I think a lot of times the messaging has been so much on neuroplasticity 0 to 3, which is important, obviously, you know, I mean, you're a pediatric neurologist, this is your life, you know, like your life. But can you talk a little bit about that too?
Yeah, so, you know, it's interesting because neuroplasticity is amazing, right? This is the reason that I was fascinated with the brain from, you know, high school, right? I mean, this is really motivating and fascinating, and has been really interesting to me for a long time, well before my daughter was born. But and you're right. I think people always talk about the tremendous plasticity that until age 2, and then maybe they'll extend till age 6, and maybe there's another window in the teenage years. But the truth is, I actually think that I think in some ways, kids who've had an early life brain injury are wired differently, and they do things differently. And I think that as long as the environment continues to be challenging and stimulating, it doesn't close. There's always time for change, right? You can always make more progress. And so don't be discouraged. Like you said, it's not a sprint. This is a marathon. It's going to take a long time. You're in this boat for a long time. It's a long road. Don't burn yourself out right at the beginning. And I think this actually plays to another thing that I wanted to share, which is that vacations are important. When my daughter was young, I was afraid to take vacations because I didn't want her to miss even a week of her regularly scheduled therapies. And then after a few vacations that we did take, I realized she made so much progress when we were on vacation. It turns out that when you are the expert on your child, right? You know what are all the things that your child is working on, and how to set up your child's environment in a way that encourages their development. And so you can do that all the time, and whether you're at home or somewhere else, sometimes changing it up can be really important. And everybody needs a break at some point.
Absolutely.
So vacations are really important. Don't feel bad about taking vacations. They are wonderful for the family as a whole.
Yeah, and we've talked about that a lot too, over the years with families. I had my own experience as well of, and we have a question about vacations. So we'll answer that in just a minute, because I think this is just such an important point. I mean, I think, to reiterate what you said too, about you can burn yourself out. I mean, it is so common for families, I would say, especially the first 18 months, where you're just like, I gotta, and you're doing, because you're a parent and no one wants their kid to have to go through this, and no one wants their baby to, have this happen to them. So you're like, I'm on this mission to, maximize everything for my child. And that it does, when we talk about it comes at a cost, it does come at a cost. It comes at a cost for everyone. And I remember getting to 18 months and we were so burned out from, all the therapies and all the, just researching nonstop and, all the things. And we finally just took, our therapists were like, you need a break, just stop, take a week off or go away for a vacation, and we did. And it was the best reset. And that was a good paradigm shift as well for us, and I know I've seen that just time and time again. Families will say the same thing of I'm so burned out. It's just my child, doesn't want to work in therapy anymore. And it's well, when was the last time you took a break, took a week off, took a month off, went on vacation, made family memories, so the question is, how old was your daughter when you started to take her on vacation?
I don't remember our first official vacation, but I can tell you that so she was born in September, and it was the year that I was applying for positions in child neurology residencies.
Oh my gosh.
And all the interviews were happening that winter. So I had my first interview. We were living in Baltimore, and I had my first interview in Pittsburgh in early January. And so she was, 4 months old, and my husband came with us. So the three of us drove, and I, very mixed feelings about the whole thing. But I will say one thing that is crystal clear memory is walking with her into that hotel. Her eyes opened so bright, just looking around and being in a new place. I don't know if it was the lights of the hallway in the hotel or what it was, but she clearly observed and felt that we were somewhere different, somewhere new. And it was a big experience. So I don't know, take from that what you will in terms of when it's right. I mean, you have to do what's right for your family, and every family is different in terms of logistics and complications, and COVID definitely throws a wrench in everybody's plans. But yeah, I think that living life as close to how you imagined it for your family is important because for so many reasons it's important, and it will trickle down and come to your children as well.
Yeah. And I remember that, I think it was after Max turned 2, and it was like in May or something. And we went to Florida, and it was, again, we were so burned out. And all of a sudden, I think it might have even like pulled a standard. It was like some big physical, we were just like sitting there, and there was like no indication. He was like crabby in therapy for months, and we're all burned out. And all of a sudden he just like did it in Florida on vacation. I was like, did we just need to do this like 6 months earlier, kid? Like, what's going on here? But no. I think there's a little bit of kids won't do things, they're never going to do things in your timeline anyway.
No, it always happens when they're ready to do it.
Yes.
But the Disney World actually was an amazing experience for us also. Again, this was before COVID, but she with her walker went all over that place and walked further than we ever could have imagined. So being lost in the experience and being excited about seeing somewhere new, I think it can do a lot. So vacations are great.
Absolutely. And again, that's that environmental sensory that that you talk about too, and just a lot of times, just even going back to we all kind of get lost in this like fix it kind of mentality, and we forget about our own needs. We forget about our like the human needs of just like doing what's enjoyable to you as a human. Is it like, so that's so important.
Back to for older kids, having therapy really be goal-based is really important, and asking your child what goals are important to them and making that be the purpose of therapy, right? Therapy can get really old when it's every week, for indefinite stretches of time. So very often what can be much more productive and less exhausting for everyone in the family is intensives that are really goal-based, right? So if your goal is learning how to put on your socks by yourself, right, or putting on your glasses, then really focus on those skills and target that, and then hopefully your child feels a real sense of accomplishment, that they are making progress with something that they care about, so they're motivated to work on those skills, and it's not stretching out indefinitely and consuming all of your resources and your time and your energy, right?
Yeah. So we do have, back to the therapy thing. Navigating the therapy maze. Vacations are a good pause to think about too, and how important that is. And we do have families that integrate therapy with vacation, with these intensives, because sometimes they're a place where you could travel to, and so we do have, we see families, if there's an intensive therapy center, located somewhere, that they kind of build in a couple of days of fun as well. And I think that goal-based therapy is so important. And I also want to encourage people to think through, and you can talk about this as well, that, we just talked through some like older kid stuff and those, but, certainly younger kids can benefit from that goal-directed therapy as well. It could be bringing hands to midline. It could be grabbing onto a toy. I've seen so many kids do, who have maybe more mobility impact, that are working on, like fine motor adaptive toys or communication or, anything like that, but it is goal oriented.
Yeah, absolutely. Really important to keep those goals in mind, for sure.
Yeah.
One other tip that I often share with patient families that I think is helpful is, we know that early intervention is critical and wonderful. Do it. It's useful, right? But at 3 years old, when your child turns 3, there's a transition in the program from the early birth to 3 program to the next level program. In Pennsylvania, it's called the intermediate unit. I don't know if it's the same in Michigan.
We call it, well, yeah, we go from early on to early childhood special education. So it definitely varies what it's called and what it looks like in every place.
And no matter what, though, that at that third birthday, there's going to be a transition, and often you may no longer be working with the therapists that you have become your family or have become so important in your life for the first 3 years. And so I usually recommend, if it's possible for your family, to add on a private therapy starting at around 2.5 years old, because sometimes that transition process at 3 can be take some time before the new therapists start and get to know your child well and can really feel productive. And so sometimes having someone start at 2.5 years old that could carry you through that transition can be helpful, and can help you feel like you're not losing a lot of ground with that transition.
Definitely. And there's, there is such a variety of how early intervention services are implemented. I know like some states like Ohio have they have one provider that is to provide all PTO, like they consult with a team and then they provide that through their early intervention. So sometimes it is resource restricted for those early intervention services through, school districts or county programs, or the state early intervention services. And so, there are outpatient therapies available that, through those private, more that would be more insurance-based, therapies.
Yeah. The other thing that's useful to know is that these fields are really diverse, right? OT, for example, is such a diverse field, right? There are OTs who focus on core strength. There are OTs who focus on sensory processing. There are OTs who focus on feeding, on fine finger movements, on academic skills and writing, there's such a broad range of OTs on vision, visual, spatial pieces, right? And there's such a broad range, and no one person can have all the knowledge of, what exists in this field. So it is useful to collect information from different people, from different resources. And sometimes your child may have different needs that can't be met all by one person. So it's useful to think about building a team who can support your child, and the parents are the center of the team, right? You are the directors of the team, coordinating communication among different team members and figuring out what are the most useful things that each team member can contribute, and help guide with and help teach you, that you can then implement across the child's environment, whether it's home or school or other places.
Absolutely. Yeah, I think that's such an important point. And you mentioned with the variety of specialties, especially with development domains, somebody had a question about suggestions and talk through, like, maybe you could talk a little bit about, especially as a pediatric neurologist, and cortical vision impairment, because that is not a physical eye, function issue. It is unfortunately, can be an impact from HIE and a neurological eye processing issue or visual processing issue.
Yeah, so typically known as CVI, people use that C to mean different things. Sometimes it's cortical, sometimes it's central, sometimes it's cerebral, but visual impairment. I like central because it just tells you that the reason for the problem is in the brain, right? It's not a problem with the eye, it's a problem with the processing that happens in the brain. So our visual world is so complex, and there's so much, there's a lot of the brain that is dedicated to processing vision, because vision is really complex, right? And just to be clear, it's complicated. It's not black and white. It's not either you see perfectly or you're completely blind. There is a lot to vision, and sometimes kids with CVI can have good vision when you test, direct, can you read this letter, right?
Right.
But it can be difficulty with understanding complex visual scenes. Opening the junk drawer in the kitchen and digging around and trying to find the one thing that you can't seem to find, right? Or understanding visual things that are moving. So examples of different things. There is therapy that's available to help with these things, just like there's physical therapy to help with motor problems, right? And these are things that can be worked on and improved. And we talked about neuroplasticity earlier. There, even if the area of the brain that is typically used for processing these complex vision functions is injured early in life, there are other parts of the brain that can take over those functions and do those jobs. And so this is something that can be improved.
Definitely. And, I know the person that asked, I want to just share for everyone that we have done we do have some resources about vision that we've collected as well from our other medical advisory board members that are that specialize in vision, both from a CVI on the educational side of things, as well as optometry. There's like so many different things that can be done either to get, a combination. And a lot of times, like you mentioned before, it's the medical team that's coming around the child. So, or, medical and educational. So, you can get services through school for low vision that adapt to the needs of the child. There's different therapies available for low vision. There's, and it might be called low vision, but they're used to working with kids with complex vision challenges like CVI. And then there's also, there's, depending on the visual field, processing deficits, they can also look at how they can, on the optometry side, bounce different, light, and around different visual field challenges to optimize and, through eyeglasses as well. So there's just a lot of different pieces to that puzzle. I mean, that's like you said, vision is very, very complex of one, the sensory impacts that can happen from HIE. But certainly there's a lot of great therapies and resources out there as well for that. Yeah. Awesome. That was a great question. So again, it's, I think, people, part of this is like looking at how you build relationships and learn about these things that are available to, to make sure that throughout the years of this journey, you have, who's on board at what different points, and that's really important. I think you as a pediatric neurologist, like one of the things that you do, and maybe you can talk a little bit about this too, is helping people get connected to those resources. Like I remember early on, our pediatric neurologist was like, yep, you should probably see, bring on, because Max has CP as well, bring on a physiatrist or physical medicine and rehabilitation doctor. So, so you kind of build the team around from that standpoint. Yeah,
that's exactly right. And both from the medical side and from the school educational side, you're really guiding that team, and it's a big job. It's not a small job to steer that ship and to guide communication, but you can really have a lot of benefit when you connect different team members in useful ways. Like perhaps you learned, maybe you learned from the ophthalmologist or the neurologist that maybe your child has CVI, and you want to connect that with the school team, with the teachers. There's a learning support teacher, a school OT, to make sure that material at school is printed in the right way, so that you're isolating the challenges. The academic piece of your child learning addition or multiplication is separated from the piece of can they understand this complex piece of paper with 20 problems on it. Well, you don't have to answer the 20 problems on a page. You can answer those problems when there's one problem on a page or two problems on a page, right?
Yes.
So you really need to connect the different parts of the team together, so that to most benefit your child.
Yeah. And I think, tying all of this in, which is so nice that it does, when you talk about the transition into ages, from 0 to 3 to 3 to 5, and then eventually K through 12, one of the best pieces of advice that I got, because Max does have a vision impairment, was to get a functional vision assessment through the school, because that was very different than the ophthalmologist's assessment. And that was like a key piece that has helped him. Max is now in 4th grade. So, he has had vision accommodations that help him access his curriculum. And, exactly to your point, like visual clutter is hard for kids with CVI. So how do you isolate that? How do you set it up? Is it a certain, is it printed out a certain way, a certain, size, things like that, and stimulating visual development when you're little. There's all sorts of resources on that. Actually, one of our HIE moms developed an app called Little Bear Sees. So that's one that I know is like very popular and talked about in the CVI circle. So it's pretty amazing to see some of those things that the creativity of need that people have created out of things like that as well, to benefit more people.
Absolutely. Betsy, I'm just going to reiterate what you just said, because you don't want it to be that Max is having trouble learning multiplication because there's 20 problems on the page, right?
Mm-hmm.
Like if you just put one problem on a page, he's still doing the multiplication, right? Yeah. So being able to isolate what are the challenges, and then figuring out what are the needs and how to accommodate and support appropriately. If the goal is for him to do math, then it doesn't matter how many problems are on the page, right? You just want to get to the root of what he's doing. So,
well, and that can be the analogy to apply to anything. I mean, truly, right? Like that is it. So that can definitely help be, I think, that lamplighter in your path of like focusing on that. What is the next thing that we need to look at? Yeah,
right.
Exactly.
Each goal, break it down into the parts and make sure that you're not asking the child to learn 20 things at once. You're breaking it down and only working on one piece at a time, right? Simplifying the problem and working on one piece at a time. Yeah, and giving them support for the other parts to help them get to the one piece that they're targeting in that moment.
Definitely.
So many,
and that's hard because we all don't have the patience sometimes for that, to go, I want it to be better now. I want to know what their life's going to be like in 10 years now.
Yeah.
But we can't get there yet. And we talk about inchstones a lot in our community, and a lot of that is based on like these incremental, but those little wins add up to a big win. So so when we talk about what that therapy looks like and that goal oriented, the big things that people always talk about are walk, talk, and eat, right? Those are like the big things. But how do we move the needle, if we can't do this in a 6-month time frame? So, but what can we do to add up all those little wins to get to a big win? So important. We have one more question, and then I think we can wrap it up. And this is a question, but can having a pet be helpful for a child with HIE?
Oh, I love it. Yes, I think maybe this sounds silly, but pets and siblings are wonderful. Mm-hmm. Especially some families, when it's their first child, they always ask if having a second child may take away some of their attention from the first child who needs a lot of support. And every family should do what's right for them. But if you were hoping for a family with more children, then I think it's wonderful to go ahead and have more children. There are things that siblings or pets, as the question asks, can get your child to do that no therapist or parent could bring out of them, right? When they're playing and loving, that can be tremendously helpful. So yes, all in on that.
Totally agree. You know, and there are, I mean, there's documented evidence, especially with mental health therapy, with, you know, with pets and things like that, where, I mean, you know, pets can be a big motivator for kids. There's programs at the library where, you know, kids read to pets, you know, to help with literacy scores and things like that. So there's all sorts of different ways. I have a friend who's getting a service animal, and we've had plenty of people in the HIA community as well who have, you know, have gotten dogs for different service purposes as well. But there's more than just a function with that. It is certainly a holistic improvement that can be made to, again, sensory system, having this dog that is not, you know, different than human interaction and all of that. So that's so great. Awesome. Well, I want to thank you for taking the time today, but also always, and, you know, being such an amazing advocate for our community, and doing just such groundbreaking work in research, and just being such a wonderful part of our community. Thank you so much for taking the time today. Thank you everyone who's been watching and listening. This will be available afterwards on our social media channels, on our website, and wherever else you can access our information. So it's not going anywhere. And if there's additional questions that come up, we'll, you know, relay them and make sure that we address those as well.
Yeah, happy to. Thank you so much, Betsy. This was fun.
All right. Thanks, everyone. Have a great day. Bye-bye.